Many kids in New Mexico will never graduate high school, much less go to college. It's a sad reality that the state has been struggling with for years. But now, some high-risk students are getting help from an unlikely source: nurses. In tonight's New Mexico Works, the story of a one-of-a-kind program that is proving to make a big difference. Inside what's called the Bat Cave, 2 floors beneath UNM Hospital, something extraordinary is happening.
So sample, what does that stand for?
Kids who are at high risk of not graduating are being motivated and guided to what could become a career in medicine.
1, 2, 3.
They're learning the basics of health care.
Is that a primary assessment or a secondary?
And how a hospital runs.
We had a group of physicians, nurses, community members who were really concerned about diversity in healthcare and the dropout of the high school population. So we met on a regular basis and came up with this diversity program.
Kathy Lopez Bushnell is one of many nurses who helped make this program happen. It's called the Nursing Diversity Pipeline. It started about 7 years ago and has become a big success.
The students we keep in contact with, which are probably 80%, have all graduated.
Stay clear of patient.
The hope is that the kids will find a career they like and move toward it. It doesn't necessarily have to be in medicine.
And it also opens up their eyes to possibly other fields. You know, accounting, logistics, shipping, receiving. These are things that a hospital needs in order for it to function.
Luke Esquivel is one of the instructors. He says the group setting helps make sure these kids succeed.
If there's one in the group that is not doing well, they all hurdle to help that person understand.
Has anybody else in your family gone to college?
No, actually, I would be the first one if I do go to college.
Prisma Varela is one of this year's students. Like the rest of the kids here, she's really motivated. But finding the money to go to college and maneuvering through the process to get in is intimidating.
Our teachers are helping us, the principal, they're helping us. It's great.
Had they not been there to help you, where do you think you'd be right now? Do you think you would be even looking at going to college?
No, I don't think so.
A lot of the nurses help them do their homework. They go and meet with the teachers, make sure they're doing well, make sure they have the courses.
Lopez Bushnell says the help for these students goes far beyond the classroom. Nurses and other health professionals help these kids in their private lives too, and they've seen some pretty startling success stories.
We had one student whose both parents were drug addicts. They were both on meth, and it was really worrisome. And so we met with CYFD, and we tried to figure it out. Well, these parents turned around, and they really supported this child, and she did get into college.
Lopez Bushnell says another one of their students got into Yale on a full scholarship. But this program isn't just about getting into college. It's making sure these kids do well in life. This program has done that too.
It's really exciting because I think when children, especially adolescents, have goals and they really want something and they feel empowered.
The program takes kids from different metro area high schools every year. They target the schools with low graduation rates and generally low-income students who don't think they can go to college. If you have a success story for our New Mexico Works segment, email me at kim.valles@krqe.com.